This week, we'll be discussing low vision conditions and I will explain a little bit about cataracts. The lens of our eyes are clear, allowing us to see every detail in a person's face, a picture, a book, or anything that we look at. When a person has cataracts, the lens of the involved eye becomes cloudy, limiting the person's ability to see a clear image. People with cataracts describe it as if they're viewing the world through a steamy glass. Cataracts is more commonly seen as an age-related disorder. However, cataracts can be developed as a result of rubella. Age-related cataracts is caused by the development of proteins that block the lens of the eye, creating blurriness by reducing the light that comes through. Cataracts is the third leading cause of blindness in the U.S., with females and African descendants being widely affected. It is expected that by 2025, 40 million persons will be blind as a result of cataracts due to the continuous damage of the ozone layer. Some common symptoms include difficulty recognizing what you see, difficulty with the way you perceive color, and difficulty tolerating glare. You can also experience cloudy or blurry vision and sometimes even double vision. There is only one method to medically treat cataracts, and it is through surgical procedure. Even though, in the early stages, cataracts can be treated with prescription glasses. If cataracts is not treated in a timely manner, you can develop more serious conditions such as glaucoma. Teresita is an 82-year-old Hispanic female who was diagnosed with cataracts 2 years ago. She's a retired elementary school teacher. She enjoys reading, watching game shows on TV, cooking, and gardening. Also, Teresita values independence and the ability to spend quality time with her family, especially with her 2-year-old great-grandson. Teresita and her family report that ever since she was diagnosed with cataracts, she's not been as confident as before. She now feels afraid of falling. She feels ashamed when she has to use a magnifying glass to read her Bible daily, or even terrified of becoming blind. Teresita has a great support system that includes her son and her granddaughter. She has lived with her son for the past 7 years, and she feels the obligation of cooking for him daily. Even though surgical procedure has been recommended for Teresita, she has decided to remain as independent as possible without any medical intervention, besides her prescription glasses. At this moment, Teresita and her family would like to find alternatives for her to read her Bible daily without as much effort. They also would like for her to remain safe within her home environment, specifically when she goes outside for gardening or to get her mail. Teresita is originally from Cuba and now lives with her son in a single-story home in Lehigh Acres, Florida, where she has one step to enter the house. There is a noticeable decreased lighting throughout the house, and there is excessive furniture in her bedroom. Teresita has a small cell phone and a tablet she uses for entertainment. She's still able to manage her medications effectively, supervised by her son. Teresita has a strong belief in having a positive attitude towards life. She's always willing and ready to learn. She reads her Bible as soon as she wakes up and proceeds to take a shower. She begins her day by cooking and picks up her mail every day around noon. Teresita also performs light housekeeping tasks as part of her routine. She normally watches the news before going to bed as a habit every night. Teresita values independence, honesty, and family time. She believes in the law of attraction. She does not present with any mental or sensory impairment, except for impaired vision due to cataracts. Teresita reports pain and decreased sensitivity in both of her legs and feet due to neuropathy. She demonstrates good strength and joint functions. She does not present with any cardiovascular disorders and demonstrates good ability to communicate and express herself. Occupational therapy is a very extensive field. Persons with low vision are among the many populations we serve. Our main focus for this population is maintaining them safe while at their highest level of function during activities of daily living or ADLs, instrumental activities of daily living or IADLs, leisure tasks, social participation, and school or work participation. As OT practitioners, we educate the patient and modify the environment as needed to help them achieve or maintain a healthy lifestyle, free of accidents and full of joy. The model of occupational therapy in low vision focuses on three important aspects of life for persons with low vision. The first step is to educate and train the patient about available technology, such as devices to facilitate reading or even modern magnifying glasses. The first step comes along with adapting or modifying the natural physical environment to prevent falls and accidents. The second step of this model pays attention to what other additional deficits the patient experiences. The third and last step of the model of occupational therapy in low vision is to inhibit or promote the patient's participation in community-related activities. This last step is what makes this model different from the rest, as it also promotes the patient's ability to advocate for themselves. Good morning, Teresita. How are you today?
Oh, good morning, Miss. It's okay, thank you.
Okay, so today we're going to go over some of the occupations that you're having most difficulty with. I know last week when I was here, we went over some education about the diagnosis of cataracts, and we decided to focus on some specific occupations that you're struggling with right now. I know you and your son mentioned that reading your prayer book daily is one of the main struggles that you have, and also that you want to stay as independent and as safe as possible within the house, as well as when you go out to the mailbox, because that's one of your daily functions within the house. So I know that these occupations are very important to you, and I have done some research and I came across some very good articles that are going to support all the information that I'm going to be sharing with you today. So my first recommendation for you will be to, I'm going to help you download into your iPad, I'm going to help you download the free version of the electronic book for your prayer book. And this is going to facilitate your ability to see the letters bigger and the words bigger, which is going to make it easy for you to read. In case if that doesn't work, there's always another option, and that will be an audible version of the book. And that means that we download something else to your iPad and it reads out loud to you. And I know it's very important to you that you read it because you're very visual and you like to see the words, but at this point we have to really focus on what's important to you, and I know that reading your prayer book is very important for a daily basis. And so my second recommendation comes with safety awareness. And I know you're very aware of your surroundings and you want to be safe within your home. You don't want to have any falls or get trip over anything that you don't see. And I have noticed that your home tends to be in the little dark side, and we want to light it up as much as we can. I know sometimes having the direct light on your eyes affects your vision and makes it uncomfortable for you to see. But I've also noticed that you have dimmable light switches. And we can work on that and see what level of light makes it more comfortable for you to walk around and see easier. And also, going out to your mailbox, you're having a hard time differentiating between your step to go in and out of the door and the tile and the driveway flooring. So what I'm going to do is I'm going to add a little piece of tape to the door so that you can see the difference between one and the other, because that is actually a very safe thing to do so that we prevent falls in the future. And once again, this is only our first visit after your evaluation last week. We're going to try this different techniques for the next 3 to 4 days. And when I come back to see you, you can report to me what has worked for you and what doesn't work for you. And then we can make some changes according to your report. Okay?
Okay.
Now it is time to test your participation in this presentation.